Hi everyone, welcome to Point of Care Nurse. My name is Gozi. Today we're talking about hypertension for the CCRN exam. For this portion of the exam, we basically need to know the difference between hypertensive urgency and hypertensive emergency, also known as hypertensive crisis. The main difference between the two is in how they affect the body. In the case of hypertensive urgency, the patient has high blood pressures, but there is no evidence of end organ damage, meaning when we run our labs, the labs are normal. When we do a physical assessment on the patient, we don't find anything out of the ordinary. When we talk about hypertensive emergency or crisis, on the other hand, there will be evidence of end organ damage plus elevated blood pressures. So when we run labs on this patient presenting with high blood pressures and hypertensive emergency, the labs will be abnormal. The LFTs may be elevated and the kidney function test may show declining kidney function. When we do a physical assessment on this patient, they might be complaining of a headache, visual disturbances, chest pain. They might say, oh, I haven't peed in a day, I haven't peed in 2 days, I haven't peed in hours. So therefore, when we talk about end organ damage, we're talking about how is it affecting the patient's kidney? Is it affecting the patient's heart? Is it affecting the patient's brain? Is it affecting the patient's eyes? So those are the organs that can get affected in hypertensive emergency: the heart, the brain, the kidneys, and the retina of the eyes. Now, there are two medications used to treat hypertensive crisis for the CCRN exam. They are nitroprusside, also known as nipride, and labetalol, also known as normodine, and Tranate. The reason I say the names of the medications, all of the names, is that I don't know about you, but for me, I will memorize the one name, be it the generic or the manufacturer, and just carry on with that. But for exams, I try to memorize the two just so I'm familiar. And if I come across it in the exam, I know what the question is asking or what it's about. Some people are okay; they memorize both names. That's good. But if you're one of those who memorizes one for the exam, it's good to know both or all so that when the question hits you, you know that's what they're talking about. Bam, I got this. All right. So nitroprusside is a preload and afterload reducer. It also causes cyanide toxicity. Now, the metabolite of nitroprusside that causes this toxicity is called thiocyanate. Some symptoms of cyanide toxicity related to nitroprusside are a mental status change in the patient. The patient might get lethargic, the patient might get restless. The patient might also get tachycardic. The patient might start seizing and having seizures. And the patient might now have unexplained metabolic acidosis, meaning the medication will not be effective at small doses anymore, or you might need increasing doses to get medication to be effective because when the patient excuse me is acidotic, it gets more and more difficult for medications to work in that environment. um, Now, this is even worse. The effects are worse if the patient has any kind of kidney impairment and when the drug is used for greater than 24 hours. That's it for nitroprusside, also known as nipride. Now, we're going to talk about labetalol, also known as normodine, and Tranate. Now, it's given in intermittent IV doses, um, preferably, as opposed to a continuous infusion, because we don't want to go over giving the patient 300 milligrams of this medication. So rather than make it an infusion and have the risk of giving the patient greater than 300 milligrams, we give intermittent IV doses of this medication. Also, after you stop the medication, this labetalol, the effects remain in the body for 4 to 6 hours. Now, this is important to know if you want to give extra doses, like you want to bridge the patient from IV to PO medications. It's important to know when is the right time to give the PO medication so that there isn't this additive effect of the two medications that will now drop the patient's blood pressure or crash it down. Um, Now, the greatest risk of hypertensive emergency is to the brain, meaning the patient might have a stroke. That's it for hypertension for the CCRN exam. I hope you found this information helpful. Please like, subscribe, share with your friends, and I'll see you in the next video.